So here are some goals that we're going to have today, and Jan asked me to do a little bit of history, so I am going to do a little bit of that. So she told me just to go pretty quickly with that, but because it is amazing that I see, and I tell doctors that I consult with now, that when you're hiring a CA, they should tell them a little bit about the chiropractic philosophy. Give them I know doctors when they're hiring that they have their potential hires to come to a new patient orientation class. Well, how easy is that? Because if not, sometimes you might get someone that's been in the medical model and you hire them and they're really outgoing and bubbly and they can answer the phone great, but they just don't buy into chiropractic. You can't fix that. You can't fix that. I mean, you can teach everything else, but if they don't buy into that, that's very hard to overcome. So we're going to do a little bit of that. We're going to talk about some telephone techniques, some personal preparation, some scripting from A to Z, some new patient protocols, ways to educate patients, some nonverbal ways. What does your office look like? What do you have on the walls? So I want to show you some really cool pictures and things from inside of other offices that may give you some ideas. We'll talk about some collections and recalls and all of those fun practice things that we all can't wait to do every day, right? And then we're going to get into some leadership rules. Now, do we go all the way through noon? Is that our schedule? Does anybody know? Nobody knows. Well, we're just going to go to noon, and then we break for lunch, I think 12 to 1, and then we're going to go right into from 1 to 3. So I've got a whole bunch of information that I'm going to share today. On my PowerPoint slide, you will see I've got pictures that have nothing, a lot of them have nothing to do with chiropractic, and so that's how you're going to be able to take notes. So you'll see a slide that'll say telephone protocols, and then all the slides with pictures will be your bullet points. And the reason I typically don't hand out notes is because I want people to pay attention. And the reason that I don't put all those bullet points on one slide is so that you're not having to write all of that and you don't hear what I'm saying, and then at the end, then we look up and it's kind of like eating lunch, having a lunch meeting. The person's talking up there, but you're eating and you're not hearing what they're saying. So, but if at the end of the weekend, if you want me to email you my notes, I will be happy to do that. But I'm going to be saying a lot of stuff today that you're probably going to want to write down. And I've got some really cool videos today, too, that I'm going to show you. Just some little snippets, again, that are nothing chiropractic. I'm known for being a big crybaby, so I'll just get that right out front. So if I'm going to cry, I want other people to cry with me. So I'll have some videos that are going to make you cry, some that are going to make you laugh, some that are probably going to humble you. So we'll have some fun with those. I always like to start my session with a little bit of a joke. So this one is, somebody sent this to me. It's called The Problem with High Urinals. And since I'm from Arkansas, I can talk about Kentucky people. A group of Kentucky 2nd, 3rd, and 4th graders, accompanied by 2 female teachers, went on a field trip to Churchill Downs, which is the famous Louisville racetrack. They wanted to see and learn about thoroughbred horses. When it was time to take the children to the bathroom, it was decided that the girls would go with one teacher and the boys would go with the other. The teacher assigned to the boys was waiting outside the men's room when one of the boys came out and told her that none of them could reach the urinal. Having no choice, she went inside, helped the boys with their pants, began hoisting them up one by one, holding onto their wee-wees to direct the flow from their clothes. As she lifted one, she couldn't help but notice that he was unusually well endowed. Well, trying not to show that she was staring, the teacher said, "You must be in the 4th grade." "No, ma'am," he replied. "I'm riding Silver Arrow in the 7th race today." So, it's kind of like a CA. We do it and then we ask questions later, right? We just jump right in there. So here's one of my go-to sources. I use the Parker manual. I also use, has Dr. Gay been here and spoke for y'all? Okay, so I speak a lot for Dr. Gay. So he's got a great chiropractic assistant manual that is a whole lot of the stuff that I teach also. So, you know, why reinvent the wheel? So I recommend that, and I do have some of those with me. So, but that's going to be my source that I go to a lot today. So I have a lot of questions for you now that I've told you a lot about myself. Ask yourself, CAs, are you happy? Are you happy in your offices? Are you healthy? Both mentally, physically, spiritually? Are you exercising regularly? Are you at the top of your game in your offices? Are you upbeat? Are you positive? Are you radiating love every day in your offices? I hope so. Are you educating patients? Are we talking chiropractic in our offices? Are we educating parents about treating children? That's one surefire way when I go into a practice, when I know that office is on fire about educating patients, if I see lots of children in that practice. Lots of children. So I hope that you're doing that. Do you have a job or a career? You think this is her job, or you think she considers this a career? Every time I see this picture, I count the leashes, and I count them again this morning. I think there's 11. But there's like a dog in the back that doesn't look like he has a leash on, so I think there's actually 12 dogs. She's got to love her job, doesn't she? And I bet she probably thinks that it's not a job, it's a career. She loves what she does. Are you excited? How many of you were excited to come this weekend? A few of you? Everyone? Yes? And I hope you're real excited when you leave. You know, it's kind of like when we think about going on vacation. How many of you like to go on a vacation? And, you know, the couple of weeks, 3 weeks before you go, you get those butterflies in your stomach. It's like, oh gosh, I just can't wait to go. This is going to be so much fun. Do you feel that way when you pull into your parking lot at your office in the morning? Can't wait to get in there. Can't wait to heal people. And if there's one key phrase this weekend that you take away from this, CAs, is I hope that you know you are a healer. We spend more time with that patient than the doctor ever will in the course of a day, other than maybe the first visit when they do their exam, if they do their exam. But I hope that you know that you're a healer. You're a healer by the way you communicate with that patient, by the way you touch them. How many of you ever had a patient that has came in, and we had this in our practice all the time, and it was so cool. Patient would come in, they would be examined, they would be x-rayed. Of course, we didn't do any treatment. And before they walked out, they said, I'm already feeling better. That is so cool. And that's because of us. And the next time a patient says that to you, I hope it gives you goosebumps and chills up your spine and makes your hair stand up. Because that is really cool. So I hope you're excited. And are you having fun in practice? Are you helping each other? You know, sometimes we're a leader in the practice, right? You may or may not be an office manager. Your office may not even have an office manager, which is fine. Sometimes you're led, sometimes you're the leader, depending on what's going on in the dynamics of the practice. In my practice, I know you guys haven't been around me very much, but my doctor was not the leader in my practice. Of course, you know, we called him the guy in the back. I don't know and that's what he wanted to be. He just wanted to be the guy in the back. And that is our job, is to let them adjust, do the physical adjusting. We'll do the non-physical healing, and we're helping each other. They're having fun in practice. I like the, so I can make this do this. I like the, I don't know if you can see there's a spider webs up here. So this is around Halloween time. Is that not cool? I mean, his smile, he just makes me want to go in and be adjusted every day. They're having fun, out volunteering. adjusting outside. That's pretty cool. Treating kids. That is so much fun. I just saw this morning. I was up in the room looking at this. Back here it says, growing is the art of paying attention to the details. That's growing. It goes back to what I was saying, the very first thing, that doctors want the diagnostic equipment or the codes or whatever. No, growing is paying attention to the details. That's what grows our practice. Because laughter is an instant vacation. So I'm going to have to take my PowerPoint down to show you these videos since that's not working properly, and hopefully they will come up quickly. Because everybody likes a vacation. Y'all want to go on a vacation with me? You all have just won a vacation. We are going on a vacation together. So how fun is that? Okay, so what do patients want? What do patients want? These are some things that I think patients want in our practice. I think they want affordable health care, right? I think they want health. Ultimately, that's why they're coming in. Some people want a full-service healthcare office, right? Now we've got massage therapists. You got some that have medical doctors in with them. They do physical therapy. You know that we do a lot of things than what chiropractic used to do a long time ago, and that's okay. chiropractic has evolved. So I'm not saying that that's a good or a bad thing. Every office is, to their own. And I think they want a caring and knowledgeable healthcare team. And it's our responsibility to give accurate information so patients can make educated and informed decisions. And a lot of times what I see in the practices, especially when we get a new CA in the office, a doctor is not educating them on chiropractic, a lot of times they don't even get examined. They just start adjusting this new CA, right? 2 or 3 weeks later. Ever had that in your practice? Yes? See some head bobs? They don't even get x-rayed sometimes. But yet they want that CA to be able to tell a patient how important it is to be examined and x-rayed and to pay for that service, yet we didn't treat our own staff that way. So we're not congruent in our message. And so our goal is to not only educate patients about lifetime chiropractic care, but also about healthy lifestyle choices. How many of you have brochures in your practice? You give out brochures? How many of you have read every single line of every single brochure in your practice? A couple of you. So CAs, sometimes it's up to us to educate our patients. We give those brochures to patients, right? And wanting them to read them, and we're asking them, did you have any questions about your brochures? But we haven't read them. So we're not congruent in our message. I had a CA in my practice one time that wasn't very good at her own financial situation, paying her bills and that sort of thing. And I didn't know it at the time that she had that situation. But she had an issue collecting from people. And then later on, I was able to put the 2 and 2 together. Because she had that issue, she also had an issue of making other people do it. So it's interesting how those things come up. So in order for us to educate patients, we must be educated. So let's do a little bit of chiropractic facts. So chiropractic is the science, art, and philosophy. So here's for one of our new CAs over there, of connecting the nervous system and the function of the body, which started in 1895. Everybody know this? Who does not know about D.D. Palmer? Who's never heard that name? Some people have never heard that name. Wow. So D.D. Palmer was searching for causes of disease and exploring different ways to treat diseases. And it was in an office building, and the janitor in that office building came by and they were talking about this, and so Dee Dee convinced him to let him examine him one day. And he did find a lump in his neck that was obviously a subluxation. He didn't call it subluxation then, but then he also convinced him to let him treat him, which Dee Dee's, if you want to go online and Google it, Dee Dee's form of adjusting was pretty brutal. So he did adjust him, and Harvey Lillard had a hearing issue. And not too long later, his hearing was restored. So, the history of chiropractic began. But yeah, a lot of times, like I said, I don't see doctors that even tell their CAs the history of chiropractic, how it started. And I've got this on a slide that I'm going to show you a little bit later on, but I'm going to say it now so I can really drill this home. When you go back to your practices, I want you to ask your doctors why they went to chiropractic college. Anybody here not know why your doctors went to chiropractic college? Anybody here not care why your doctors went to chiropractic college? I bet there's somebody here that does not know. Who does not know, really? So your doctor has a story, and I'm not sure what that story is, but I bet it's a pretty cool story. Because there hasn't been very many chiropractors that I know of that went to chiropractic college because they just, said, oh, my buddy we're going to chiropractic college, so I decided to go too. So there's some kind of life-changing experience. Who's you a spouse of he have a life-changing experience with chiropractic?
Well, we were newlyweds, and he was going to law school at 11, and so I had to get a job. So I went to work for a chiropractor, and I would come home and tell these great stories, and he said, "Don't let him touch you." And pretty soon he went in and met the chiropractor and got familiar with what was going on. And he said, "I'm going to quit law school. I'm going to chiropractic college."
How cool is that? The world was saved by one less lawyer. Chiropractic did that. Now, that's very cool right there. My doctor actually, he had a daughter that was 18 months old, had taken a tumble out of a truck. She was standing up on the seat and fell out of the front seat of the truck. And within a couple of days, stopped walking, talking, eating, didn't have a bowel movement. Went to, had the MRIs, Children's Hospital, all that. They could not figure out what was wrong with her. He happened to stop by a friend of his from high school that was a chiropractor office, and an older chiropractor. I say older. He was probably 30 or 40 years older than these guys, so they considered him, the wise one. And it's interesting that the friend that he took him to, the chiropractor, said, "You should let Dr. Sloat take a look at her." He didn't say, let me adjust your value, but he said, "You should let Dr. Sloat take a look at her." And he did, and within that evening, she had a bowel movement. He said, like a really big bowel movement, and adjusted her, the next few days. And within a week, she was back to totally normal. So he actually was working on the railroad, had small children, couldn't afford to go into debt anymore, but quit his job, took out student loans, went to Kansas City, and graduated magna cum laude of his class. So, but, and I hope that when you find out what your doctor's story is, that you're telling that story to your patients. Your patients need to know what that story is. But so for those of you that don't know, find out the story, because I bet it's something good. A lot of times we'll have our patients, they'll say, "Oh, I've got a bulging disc, herniation, or rupture." So this is what it is. It's trauma to the spine that can injure one or more of the spinal disc and cause the soft tissue to bulge, herniate. A lot of patients will say, "Oh, I have a slip disc." Y'all ever heard that? Which is an incorrect term. Discs don't slip, they bulge, they herniate, they rupture. And then the brain sends down the impulses to the spinal cord out of 31 pairs of nerve roots. So these are things that you can be, saying to your patients also. And again, I'm going to go real quick because she just told me just to briefly touch on this. If the vertebrae ever lose their normal motion in position, they choke or irritate the pairs of nerve roots, which is called a subluxation, right? Bone out of alignment, pressing on a nerve, which causes irritation or numbness or, whatever the patient has going on. So in simplest terms, a subluxation is when one or more of the bones of your spine move out of position and create pressure on the spinal nerves. And there are 24 movable bones in your spine. And believe it or not, stress, toxins such as alcohol, tobacco, drugs, trauma can all cause subluxations. I hope you're telling that to your patients. You have a patient that's coming in and for whatever reason, they just may not be getting well. You know what, maybe they may be a smoker. They may be a heavy drinker. They may be taking prescription drugs. So there may be some other factors going on of why those symptoms are not being relieved as quickly as we like them to. And here's some fun facts. The popping sound, and you'll hear this in your practice. I just hate that popping sound when you adjust my neck, right? It's just the shifting of fluids and gases. So, keep it in simple terms for your patients. You don't have to get, over dramatic with it or, use big fancy words. So keep it simple with them. And you are more likely to be struck by lightning than to have a negative reaction in a chiropractic office. I love that one. And here's a little bit of terminology. Anterior, towards the front of the body. And how many of you take notes before the patient goes and sees your doctor? Anybody, do chart notes or take notes? A lot of you do? Or take notes when they're, I know some CAs that are in the rooms with their doctors and they're charting as the doctor is seeing the patient. So anterior, towards the front of the body. Shoulder, I have anterior shoulder pain. So, you can be using these terms. When you see it in a chart, you'll know what it means. Posterior, towards the back. Anterior, posterior shoulder pain, towards the back of the body. Atlas, the uppermost and most freely movable bone under the skull. It's what Harvey Lillard got adjusted, was his atlas. The cervical spine. 7 vertebrae are in your neck. There are 12 thoracic vertebrae, 5 lumbar vertebrae. The sacrum is 5 fused vertebrae at the bottom, and then your coccyx is 3 that are fused below that. And I've got a little, let's see here, there we go. So there's your cervical, C1 through C7, thoracic, lumbar. So here's your sacrum, which is these 5 that are fused. Some people get that confused. I think it's all one. It is all one mass, basically, but it is 5 fused vertebrae. Then your coccyx is 3 fused. Prone. Does your doctor adjust patients when they are prone or supine? Both, yes. Atrophy is a decrease or shrinkage. We'll see that a lot with maybe a bicep. We saw that a lot in our office with the bicep, which is just a shrinkage in the size of the muscle. Dermatomes, skin sensitivity. So when you may have a new patient that comes in and says, it's real sensitive right through here, you could say, oh, that's dermatomes. You sound a little educated. That's good to use those terms with patients. Edema basically is swelling. It's a condition when the fluid fills a joint. Spasm is the contraction of the muscle tissue, a prolonged spasm. Lateral is the side view. Like we do the x-rays, right? Lateral, AP, anterior, posterior, and lateral x-rays. And you can find this chart on, you can Google it, and it's out there. So let's talk a little bit about some constant marketing. Some things that a lot of people, we don't even realize where we're constantly marketing in our practices, but things that we may be doing or not doing in the practice. A new patient phone call is constant marketing. The way you answer the phone, the way you ask questions to patients, you're constantly marketing to them. If you ask them who referred you in, you're letting them know that our patients refer in. Recalls is marketing to patients. We're letting patients know that we care. We're serious about their health care. And probably they need to make up that appointment, right? They're not off the hook. Sure, you may not have made today, but, can you come in Monday or Tuesday to make up for today's appointment? So that's marketing to patients. Daily patient education. What are you giving to patients? Are you giving them brochures? Are you giving them ice tips? You give heat, whatever the protocol is in your office that your doctor has you to give out. Do you have sign-in sheets at the front desk that say certain things? Anybody have any cool sign-in sheets that have like Cairo facts on them? Anybody use those? No? I think I've got that on one of my slides here in a little while, so I'll show that to you. Your office decor. All of that back there are children that they treat in this practice. And you can still do that even with HIPAA. HIPAA, it's amazing how 10 years ago we were all so afraid of HIPAA. But all you have to do is get the patient to sign and you can put them there. So we didn't have a kids board at one time, and then we did make a section on a whole wall, and we were taking Polaroid pictures. And so we would take a picture and we'd put Anna and we would put ear infections. And so we'd put her picture up on the wall, and the next thing you know, the whole wall was filled. And then we had some kids posters beside it, and it was amazing that patients would be waiting in the reception area. We had an inner and an outer reception area. So they'd be waiting in the inner reception area, and they would say, "What are all these pictures on the walls of these kids?" And the first time I heard that, it was almost like a dagger to my heart, because that patient had children, but she didn't realize that those were children we were treating. So that was our fault. So, we just assumed that when they saw everybody else with their kids in there, that they knew they were getting treatments. So a lot of times we started leaving the doctor would leave the door open when he would adjust children, so that other people could see children being adjusted, because, kids don't care. And this is a nice, clean office, isn't it? Got their picture here, nicely framed picture. But all their chiropractic stuff is over here, like, don't touch. You can look, but don't touch. Doesn't look very inviting, does it? And then down here is probably some Better Homes and Gardens magazines or something. But it's not chiropractic stuff. As opposed to this. Chiropractic, the path to wellness. So they've got their vertebrae there. Look, they've even got a bulging ruptured disc here. That's pretty cool. And those are just posters on their walls. So see how that's a nonverbal way that they are educating a patient? And I've got a whole lot more I'm going to show you at the end. I like this one. It's kind of cut off here. Let our family take care of yours. They give out water bottles to their new patients. I like that. That's a waterfall right there. It's pretty cool. Soothing sound, peaceful sounds in your office. Now don't go back to your doctor and say, "Brenda says we have to redecorate." I'm going to have 20 doctors lined up afterwards. But if you do want to send me a picture of your practice, I might take a look at it and give he or she some suggestions. And here's one that's not, the best of the best. But look, subluxation's good on your nerves. I like that. Look at the big pin right there. Nobody's walking away with that pin, are they? I bet they have fun in this practice. I don't like this. I'm not sure if this is candy here. I hope it's not candy. I hope it's vitamin C or zinc lozenges or something. But I like look at their little spinal pins over there in the holders. Got their clipboards all lined up. I bet this person's a type A personality. Not sure. Look at that clean desk. That probably looks like your doctor's desk right now, doesn't it? No? I'm not the only one that my doctor didn't have a clean desk? Okay. Chiropractic table in the practice. So what kind of practice do you want? And the doctor is the captain of the ship. So he or she ultimately will decide what kind of practice that you want. However, I've seen this many times in practices. The doctor would say, we're a wellness practice. But then he or she were only treating patients for 6 times or 8 times or until they were out of pain, and then they were gone. And I'm like, that is not a wellness practice. That's a Band-Aid practice. So if your doctor says he or she wants a wellness practice, but you're not speaking subluxation, you're not educating patients on subluxation, you're not doing multiple appointment programs. How many of you do multiple appointment programs? A few of you? Where you're scheduling him, how many schedules 3 months at a time, at least 3 months at a time. 6 months at a time? How long do y'all schedule at a time? They do 6 to 8 months at a time. Anybody do longer than that? That's good. Then patients have options. They have choices, right? So do they want a wellness practice or do they want a pain practice? And I've been in both practices, and they both can be very successful. They both can, and actually the chiropractor that I see now, the doctor that I worked for was, I've gone like opposite end of the spectrum. He was diversified wellness practice. I now see a activator pain practice. I go crawling in. I'll probably be crawling in Monday. They'll say, "You've been at a seminar teaching in high heels, haven't you?" Yes. Or I'll go in and they'll say, "You've been playing golf, haven't you?" Yes. But both can be very successful. But if you have a subluxation practice, you should be subluxation based. And there were many years in our practice that we were a wellness practice, but it was interesting that we did not even utter the word subluxation in our practice. We were not using that term with patients. And I'm not sure why. Well, it's the doctor's fault, basically. So I'll just pass it right there, because ultimately it's he or she, it's their responsibility. And he wasn't speaking subluxation to us, so I know he wasn't speaking subluxation to patients. So therefore, we weren't speaking subluxation. We were saying misalignment, is what we were saying, but I really think you need to be using that word subluxation to your patients. And actually, we got so fixated on it that when we came back from a Parker seminar, I actually had a banner made up. Well, it probably was a 6-foot banner, and I put it up above the view boxes, and it said, "How many subluxations do you have?" And so every time that he was going over x-rays with patients, from that day on, he started telling them how many subluxations that they had. He didn't only just give them, show them. He would say, "You have 6 subluxations." And then they would come back out, and that was the first thing that they would tell us, because that was how we changed our practices. They'd come back out and they'd say, "Brenda, I have 6 subluxations. Dr. Roberts told me to tell you." I'd be like, "Wow." They'd say, "Is that a lot?" "Is that a lot? You only have 24 movable bones in your spine. 6 is a lot." So see where you can use that 24? You have 6 subluxations? Absolutely. That's a lot. You have 31 pairs of nerve roots coming out your spine. So there's at least 6 opportunities